You've been trying to get pregnant for 6 months and things have not worked out very well. You are asking yourself, what advice, what tips do you need to follow? What are the tips you need to follow for you to get pregnant faster? Married for 6 months, but things are not working out, you are not getting pregnant. In this video today, we are going to discuss what tips should you follow so that you can get pregnant faster. Mu video yaffe ne ya leero tugenda kwogera ku biki by'osobola okubanga ogoberera obanga obadde ogezezaako okubanga ofuna olubuto naye ne bibanga bibadde bikyakutawaanyamuko. Tugenda kwogera ku tips to get pregnant faster, biki by'osobola okugoberera okulaba nga osobola okufuna olubuto amangu ennyo. Gerald Massa, the health educator, is the name of the channel. I welcome you, my viewer, my subscriber, for today's video. If you have any questions, remember you can ask all your questions down below in the comments of this video. So without further ado, one of our subscribers has asked a question and she has said that she's been with her partner for 6 months trying to get pregnant, but things are not working out. What is the problem? So if you are below 35 years old and you've been with your partner for at least 12 months without getting pregnant, then it means there could be a problem. But if at all you've been together for only 6 months and you have not yet got pregnant, probably there could be nothing wrong. Maybe you just need to spend more time with your partner whereby you can easily actually get pregnant even without medication. So if you are below 35 years, we always advise that you be with your partner, you try to get pregnant for at least 12 months. That's actually one year. If at all you try for 1 year and things do not work out, then we advise you can come to hospital whereby checkups can be done on you. Obadde ogezezaako okufuna olubuto naye ng'ate oli wansi ew'emyaka 35, tuba tugamba nti oba olina okubeera n'ebbaawo okumala ebbanga ery'omwaka ogumu, that is emyezi 12, olina okuba nga obeera n'ebbaawo emyezi 12. Singa oba ogezezaako emyezi 12 n'obanga tosobodde kufuna lubuto, then kiba kitegeeza nti wandibanga waliwo obuzibu, awo oba olina okujja mu ddwaliro. Remember, we are talking about how you can get pregnant faster, the tips for you to get pregnant faster. And we are answering a question that was asked by one of our subscribers, and she said she's been with her partner for a period of 6 months with no pregnancy. So the first part I've just talked about is all about understanding that if you are below 35 years, then please, you should not worry. If you've not been with your partner for at least 1 year, you should not worry. Maybe you just need to spend more time with your partner. Things can always work out. You can get pregnant. But if at all you are above 35 years old, you are a woman, you are a couple, more specifically, you are a female, you are a woman, and you are actually above 35 years old, and you've been with your partner for at least 6 months, and you are not pregnant, then it means that there could be something wrong. On this channel, we do talk about fertility, pregnancy, and also reproductive health. So, if you are above 35 years old, and you have tried to get pregnant for a period of 6 months, and you are not yet pregnant, there could be something happening. It could be that maybe in your reproductive system, maybe the tubes, your fallopian tubes may be actually blocked with either free fluid or adhesions. And then also it could be that probably your ovaries are present, but they are not ovulating. You could be having issues with ovulation. You could be having actually issues with releasing your eggs on the 14th day, also known as the ovulation calendar. We've talked about all this in our previous videos. Tugambye nti obanga obadde olina emyaka 35 ate nga okudda waggulu n'obanga ogezezaako okubanga ofuna olubuto n'ebbaawo ne wabanga ate muli waggulu w'emyezi 6 nga mugezaako. Olina emyaka 35, olina ebbaawo mugezezaako emyezi 6 naye nga tosobodde kufuna lubuto, tuba tugamba nti olina okujja mu ddwaliro n'olaba omusawo n'aba nga akunnyonnyola biki ebisobola okuba nga biri kuviirako embeera eno. So we've said that if you are actually at 35 years and above, and you've tried for at least 6 months, you should come to hospital. The main reason is that your failure to get pregnant, your issues, your challenges in getting pregnant could be brought about by either your fallopian tubes being blocked or your ovaries not being functional, also known as dysfunctional ovaries. And then also it could be that you could actually have what we call the disease of the uterus. Diseases of the uterus are very many. They do include endometritis, which is actually the inflammation or the inside of your uterus becoming swollen, becoming actually affected by free fluid, which comes in from your private parts as a result of poorly treated infections, poorly treated urine tract infections. It could also be that probably because you've taken long without getting pregnant, you are above 35 years old, and maybe prolonged exposure of the hormone known as estrogen on your uterine wall, it actually also brings about what we call fibroids. Fibroids can prevent you from getting pregnant. The main reason is that they actually could be submucosal fibroids which affect the inside of your uterus, and they could actually make implantation difficult. That's when you do the ultrasound scan and your doctor for scan will tell you that the baby has implanted in the cervix. Probably the baby is growing in the cervix, and when the baby is growing in the cervix, then it means that there are high chances of you having a miscarriage. We are talking about the tips to help you get pregnant faster, and we have said that you should be able to have a healthy uterus free from disease. Fallopian tubes should not be blocked, and then also your ovaries should be functional. Talking about the man, your husband should be actually having or should be able to release sperms of good quality and good quantity. And then also your husband should be functioning very well in such a way that the testes where the sperms are made or where the sperms are manufactured should be functional. If at all your husband has diseases of the testes, for example orchitis. Orchitis is inflammation of the testes, and then also maybe there's free fluid in the testes. Amazi mu nsigo z'omusajja, in our local language here in Uganda, you may realize that this can also bring about fertility issues. You go to hospital, you are the woman, you do all the tests, you do the pelvic ultrasound scan, you do the urine analysis tests, you do the other PR tests for syphilis, but all of these turn out to be negative. Probably it's high time you went back and talked with your husband, whereby he will be advised to go to hospital and do what we call a semen analysis test, where the sperms will be analyzed for the quality and the quantity. And then of course, in case there are any deficiencies that are identified, then treatment can be given. Tugambye nti biki byosobola okubanga ebisobozesa omukyala n'omusajja okubanga mufuna mangu olubuto biri very simple. Mulina okubanga at least omukyala ensekeze zikola bulungi, ate n'ekirala amagi g'omukyala galina okubanga gali functional nga asobola ovulatinga, n'abaana erina okubanga terimu bizimba byonna byonna, n'ebirwadde ebirala nga endometritis, endometriosis. So we have talked about the tips for you to get pregnant faster. We actually are going to summarize this video by saying that for you to get pregnant faster, the ovaries should be functional, the fallopian tubes should be open, the uterus should be free from disease. The man should not be having diseases of the testes, for example, orchitis. The man should be able to actually function normally, whereby if he ejaculates, he should not be having what we call retrograde ejaculation, where the sperms, instead of going into the female reproductive system, they actually flow backwards into the urinary bladder of your husband. So all these can be identified in hospital. If you have any questions in regards to fertility, please, you can ask all your questions down below this video. You could also schedule a private consultation with me on my website. It is actually www.fertilityeducator.site. Instead of .com, we put .site. It's just below this video. And then also you can go down in the comments. You can actually click on the first part, which actually is having the directions to how you can do the booking. GERALD Massa, the Health Educator, is the name of the channel. Remember, you can ask me all your questions. I can answer all your questions in regards to fertility here on YouTube. If you would like to talk to me privately, then you can join me on my website where we shall talk more about how you can get pregnant faster naturally. Have yourself a fantastic and healthy day. May God bless us all. Bye bye. Sanyuse nnyo okubawuliza era mwebale nnyo okubanga mubadde naffe. Bwe muba mulinayoko ebibuuzo byonna olinayo ekibuuzo kyonna kyoyagala okubuuza ekikwatagana ne butya bw'osobola okubanga ofuna mangu olubuto, ogezezaako okufuna olubuto naye nga bikyakutawaanya, wayinza okubanga waliwo obuzibu either mu nseke oba ku magi oba mu nabaana, olina okubanga ogenda mu ddwaliro dokita wo n'aba ng'akola sikaani n'akebera n'enkwaso eza bbaawo. Sigadde amanya gange bampita musawo Gerald Massa era togera ku ebyekikyala byonna oba obadde olina ekibuuzo ekyo ekyakutawaanya ennyo ng'oyagala tubeere nga tukiddamu, osobola okugenda mu comments eza vidiyo eno n'oba ng'obuuza nja kiddamu. Oba oyagala okuba ng'oyogera nange privately, toyagala kuteeka kibuuzo kyo ku YouTube buli omu akirabe, osobola okugenda ku website yange n'obookinga kyangu nnyo. Website eri very simplified, ogendayo n'oba nga bakulagire ojja kufollowinga steps ezo zonna tujja kuba twogera. Ate consultation fee ya siringi kasanvu kokka, kasanvu ndooza kasanvu bitaano zokka osobola okuteekayo okutunuliramuko akasanvu ebitaano ne knowledge gy'ogenda okufuna egenda kuba nga eri very valuable. So sanyusa nnyo okuwuliza, webale kulaba vidiyo yange n'enkyakomawo tujja kuba twogera ebisingako ku women's health, reproductive health and fertility. Have yourself a fantastic and healthy day. Bye bye.